Hello everyone, I'm Dr. Andrew Sharman, President of IOSH. I'd like to thank you all for joining us on this webinar today. I just wanted to address you all as your President with a note of support as we try to cope as well as we can through this unprecedented challenge as the pandemic continues. Covid-19, the coronavirus, has and still is continuing to disrupt our lives. We're having to isolate ourselves, distance ourselves from family and friends, work in different ways, not being able to engage or interact in the ways that we're used to. And it's very unsettling, isn't it? From a personal perspective, I found myself in exactly that situation. A quick 4-day trip to visit my family in Scotland turned into 3 months living out of a weekend bag. I was locked down in a rural location, away from home, fed up out of living out of a suitcase in an Airbnb rental apartment, not being able to go and see my family. I also managed to contract the coronavirus and had several weeks of not feeling particularly well, and still have some unpleasant symptoms, which the doctors tell me will hopefully be gone soon. But it's great to finally be back in my home in Switzerland, which is where I talk to you from today, and try to find a way to get back to normal life, whatever that may be. But haven't we all had enough of this pandemic by now? Isn't cabin fever setting in for all of us as we get frustrated? But all we can do is be patient, which those of you who know me will realize that that's not something that comes naturally or easy to me. Despite all said, we do need to take away the positives from the pandemic, embracing the time we've had to spend with those we love, finding ways to strengthen connections with others through webinars like this, or through video chats, phone calls, letters, social media, and instant chat messaging. Over the last few weeks and months, I found myself writing handwritten notes to people that I realized that I've probably lost a bit of touch with, but they're still very important in my life. So I wanted to reach out and say hello to them and let them know that I care. Of course, there's the constant news feeds on the pandemic too, aren't there? They're hard to avoid, as the coronavirus dominates every newspaper, news feed, and news report around the world. But there's a balance, isn't there? We can get too much news, I think. And indeed, one of the biggest risks from this pandemic is the infodemic that accompanies it. I'm trying hard not to get caught up in the news reports at the moment and instead take my updates from the scientific institutions once per week. I suppose we're all finding ways to cope and to understand what the pandemic means for us and what our role is, whether as a husband, wife, partner, brother, sister, father, mother, friend, colleague, or other. You know, one of the things that I've been thinking about during the pandemic is the importance of human connection. Whilst governments around the world have talked about the importance of social distance between people, I think that's a misnomer. What governments really want is physical distance between people to reduce the risk of spread of the virus. And that physical distance is absolutely important, and it's one which we as IOSH professionals must lead and role model to other members of our communities, societies, and corporations. But of course, social distance is reducing actually as we find these ways to connect with each other. And that's an important part of coming together as one human tribe. One thing that's really important to me as your president is the work that you do. It's never been more important than now that the profession has an opportunity to come right to the fore in this pandemic. At the end of March, I recorded a short video message for all of you around the world as IOSH professionals. And I made a second one at the beginning of June. You may have seen them. They're being dubbed my co-videos, where I spoke about all the amazing efforts of IOSH professionals around the world, including nearly 48,000 of us IOSH members in 130 countries right now. Many of our members are either working from home with families and kids around, or from makeshift desks on our dining tables, sheds, or spare rooms. And then there are those of us who are in different, displaced, or unusual work environments, or trying to find ways to get back to our usual work locations. Regardless of where we are, we're all joining forces as one to ensure that we and our membership remain strong. And for me, it's a real pride and honor right now to be your president, particularly in these turbulent times during the pandemic. So if you haven't already seen these videos that I've recorded for you, you can watch a copy of them on the IOSH Coronavirus Resources page. Please feel free to share it too. in your own networks and let others watch those videos and share my thanks to you and everyone else working in IOSH right now. In those videos, I also spoke about the IOSH Benevolent Fund. Many of our members right now might be facing hardships during this challenging time. And that's where the Benevolent Fund could offer a lifeline of financial or other support to members who are struggling and need a little bit of extra help right now. So I encourage you to take advantage of this if you find yourself in this situation or know someone that might be able to use just a little bit of help. To find out more, just visit iosh.com/benevolent fund. To show our support, every member of the IOSH presidential team has donated to this vital fund and would appreciate all other contributions, no matter how small. Every pound, dollar, and cent can help one of our members. So if you're able to make a small donation, don't worry about how small. Please do so and consider boosting this important fund to help your fellow colleagues. Donation is quick and simple, taking just 2 or 3 minutes by credit card online at iosh.com/how-to-donate. It goes without saying that we'll be feeling somewhat anxious by the changes that we're experiencing. And to address this, I'll soon be handing over to Louise Hosking, Vice President, who will present a session on how our mental and physical well-being can be affected in these difficult times and how to mitigate those effects. I hope that you'll all take something away from that session today. Kayode, Vice President, will also be joining us today and will manage the questions that you post through the Q&A box. So if there's anything that's on your mind that you'd like to ask me as your president, please start typing your questions in the Q&A box now, and Kayode will share those with me when I finish speaking in just a few moments. Your questions for Louise on the topic of mental and physical well-being can also be added to the Q&A box too, and Kayode and Louise will discuss those at the end of Louise's session. One thing that I'm sure about is that our members are critical to a safe and healthy recovery from times of crisis and occupational risk like this. It's important our membership is supported, and the presidential team are very proud of efforts dedicated to doing this. So far, we have taken this presentation to more than 900 members across our network and still have many branch and group events scheduled for the forthcoming weeks. During these difficult times, it's important to remember that the little things we do often make the biggest difference. Looking out for one another, our loved ones, our friends, our neighbors, recognizing and thanking those that are working through this period, whether it's the key workers, those on the front line, or your colleagues at work. A phone call, a letter, a video call, whatever we can do to stay connected. We're all on this journey together, and as one IOSH, we'll succeed this virus. I'm sharing my personal journey each week in my LinkedIn posts, which I'm calling The Life of the IOSH President. And I encourage you to get involved in the discussions there. Just connect with me on linkedin.com/in/AD Sharman. I'll be happy to connect with you, and you can read my weekly posts there on the life of the president in the pandemic. Of course, IOSH will continue to keep you updated and support you throughout this challenging period. Just keep an eye on the IOSH website. In particular, the COVID page, where there's a number of resources updated on an almost daily basis. Now, as I said at the beginning, right now is the moment that the profession can really shine. Our profession has never been more needed and never been more important in my view. I think now is the time that we'll look back at in years to come and say, that's when things really changed. That's when we, the IOSH profession, were really valued. Thank you for your time today in joining us here on this webinar. I wish you all the very best. Take care, and don't forget to make time for yourselves as well as looking after everybody else that's in your life. Think about your personal, mental, and physical well-being too. Stay safe and be well. I'll hand over now to Fowode, one of our vice presidents, who will share your questions directly with me. And if you haven't had time to type one in yet, don't worry. Just indicate to Kayode and he can switch you on live and you can ask your question directly. Thank you again for your attention. Kayode, over to you.
Thank you, Andrew, for that wonderful speech. We've got the questions coming in now. We'll have 2 questions from Akbar and one. I'll take the one from Akbar first. So how do we cope with post-COVID-19 situation as we head back to office and site works? So do you want to take that, Andrew?
Yeah, it's an important question, isn't it, Kayode? As we think about how we return to work safely, there's lots of things on our mind. There's, of course, the anxiety and fears about returning back to a workplace where other people are, where the physical distance that I talked about may be difficult or challenging to achieve. As IOSH practitioners, we immediately think about how do we control those risks. And of course, as we've seen in societies around the world, people are immediately leaping to PPE, wearing gloves and face masks. I don't think that's the answer. Of course, we know from the hierarchy of controls, PPE is one of the last resorts. So we need to think more broadly about how we engineer safety in, creating safety rather than just trying to prevent accidents or ill health. One of the resources that we have as members of IOSH is the coronavirus resources page, which is updated frequently, and also the webinars that we run every Thursday, including pragmatic and practical ways to return to work safely. So I'd point everybody on this call to the coronavirus resources page on the IOSH website, and also checking into those webinars on a weekly basis. We've had hundreds of people joining us on these sessions, and the focus now as we shift back to returning to work is indeed on the risks associated with that.
Thank you, Andrew, for answering that. We also have another question here from John. How do you have a message? Do you have a message for members on the importance of engaging with the council election that was open on July 1st?
Yeah, so it's great that this year we saw record numbers of people applying to join council. The nominations period has now closed, and applications are running now towards assessment. In fact, I say the nominations have closed. Having a validated nomination has now closed. So you need to make sure that you've got legitimate proposers and seconders, and your application is on its way in to IOSH. It's really important that members get involved in the governance of a professional body. We are IOSH. I've used the term one IOSH today, but I really mean that we together shape the future of what and who IOSH really is. IOSH Council is the voice of the membership, and through councillors, we're able to bring the voices of 48,000 people to one room, the council chamber, where I, as chair of council, are able to hear those voices, share them with others in the room, and also push them into the thinking of our senior leadership team at the Grange, and also share them with the board of trustees. So it's a great opportunity, but that's not the only opportunity for members to get engaged. There are stacks of governance opportunities, from joining the board of trustees to joining your local branch or specialist project teams too. So if you're interested, keep an eye on the IOSH website, look out for those IOSH emails coming in over the course of the next few months and into the future as we share vacancies with you.
I think we may have lost Kayode just briefly. Are you there, Kayode?
Yeah, Louise, I think I'll give you an opportunity to pose a question to Andrew at the moment. Do you have any question for Andrew?
Yeah. So a question that's coming from Peter Kelly. Hi, Pete. Is it time we reboot the health and wellbeing movement to focus on organisations and not just on the individual?
Oh, yeah. If this is my friend Peter Kelly, the senior HSE, then Pete, good question. Good to hear from you. Thanks, buddy. Yeah, look, is it time to reboot health and well-being to organisations? Absolutely. It's been too long, hasn't it? I think for such a long time, our profession has been dominated by the S for safety rather than the H for health. And in the past, I've talked about us having a capital S for safety and a lowercase h for health, meaning that IOSH practitioners sometimes find it hard to talk about health and well-being. And indeed, that's what I've found around the world as I talk to members, that often IOSH practitioners say, well, I'm not a doctor or a psychologist or a health professional, so I can't really get involved in that. But actually we can. And we all have an obligation as IOSH professionals to talk about health and well-being as much, if not more, than we talk about safety. Now, you don't have to be a medical expert to talk about and raise awareness on these topics. You don't have to be an expert or a mental health specialist to talk about the importance of weaving well-being into our organizational strategies. But of course, we do need to know where our boundaries are. That's one of the requirements of us as members of IOSH, to know where our limits are and to seek professional advice. but that doesn't mean we can't get started. So I encourage everybody to start thinking about health and well-being in a little bit more detail and working out who in your network you can turn to for guidance to help you weave well-being in to the future success of your business. That's
a really great answer. Thank you, Andrew.
Thanks.
A really, really good question that's posed by Louise Smith, which I think you'll be able to answer really well. Has the current situation impacted on plans to roll out the update to membership grading? And I know this is an area that, you know, we have been talking widely about, but perhaps you can share what's going on in IOSH around the membership grades.
Yeah, look, great question. It's on the forefront of all of our minds, isn't it? As members of IOSH, we're all wondering what the future looks like as we go through this grades review. The question is simple, perhaps deceptively so. Is there an impact? Yes, there is an impact. The pandemic has had an impact on everything we do. Staff at the Grange have been relocated to working from their homes over the last few months, as many of us on this call probably have. So that's had an impact on everything we do. But in my monthly one-to-ones with our CEO, Bev Messenger, I'm delighted to continue to hear from Bev that it's business as usual. And doesn't it need to be business as usual for all of us, whether we're staff at Grange or members? We need to ensure that we strive for a healthy world of work that's safe and allows everyone to get back home at the end of the day, wherever they're coming from or going to. So the member grades review, like everything, is carrying on as business as usual. And it's an exciting time for us. I hope that everybody on this call has taken the opportunity to respond to the survey request that came, spending a few moments giving your thoughts on it. Because, as I said before, we shape the future of our professional body, not the staff at the Grange. They simply build up the plans and work out how to make it happen for us. Our voices are absolutely critical to help shape what we look like as a professional body in the future and how we focus.
Okay, thank you, Andrew. Just a question from Anne Isaac. Given that there are employees who feel their job is already at risk, what advice would you give to those employees who feel that the employer has not taken adequate precautions regarding their return to work?
Yeah, look, I think we all have an obligation, whether we're IOSH professionals, workers on a shop floor, team leaders, managers, or senior leaders, that if we see something that's not right, we need to say something. So if we're in a position where we don't feel that risk is being effectively managed, it's absolutely our right and our obligation to speak up, to talk about that. Now, we all have to take some responsibility for ourselves too, don't we? I was standing in a line earlier today and people weren't respecting the social distance or the physical distance that the government of Switzerland requires. It's 2 meters. And this person was standing right next to me. They were wearing a mask and I was wearing a mask, but I felt uncomfortable. Now, after about 10 seconds standing there stewing, thinking this isn't right, somebody should do something, I realized I was the somebody that needed to do something. And I said to them very respectfully, please, would you mind moving back a little bit? And let's keep 2 meters between us all. And they nodded, and a little sparkle in their eyes, as if they were smiling beneath the mask, and said, sure, I'm sorry. And as we did that, it was almost a behavioral nudge for others in the queue. They saw what we were doing, and a bunch of other people started readjusting themselves too. So I think we need to step up and show some leadership at this time.
Thank you. Yeah, Louise, you want to?
I was going to say, we've probably got time for one more question from Claire Warman. Do you have any advice on how we should undertake risk assessment in respect of the BAME community? You know, she feels they've been very open throughout the COVID crisis, but it's a tricky one to risk assess. And, you know, we are all talking about risk assessment at the moment.
Yeah, look, I'm not sure I'm skilled enough to give specific advice on that query, but what I would point Claire to is the resources, again, on that coronavirus webpage that we've set up on the IOSH site, where there's a stack of resources, including risk assessment guidance right there. And also, Claire, those videos, those webinars that I mentioned that we're running every Thursday, there's a replay for all of those too. You find that also at that coronavirus homepage on the IOSH.com site. So you can go back and choose any one of those webinars that you want to see, replay it again and take all of that learning. And every presenter that we have in those weekly webinars All of their slides are available for download for free too. And while I'm talking about those, of course, this webinar that we're recording right now will also be available in a couple of days' time for replay if you want to go back and look at anything that I've been talking about, or perhaps more importantly, the session that Louise Hosking is going to run for you in just a few moments on well-being. That might be one you want to watch again too.
So Andrew, thank you, Andrew. But before you go, can you quickly take this last question, please? How do we best interact with and support colleagues when we may not know what their experience is, and it may be different from our own? It's quite tricky, right?
Yeah, that is a tricky question. As a psychologist, my brain flummoxes a little bit. How do we interact with people where we don't understand what's been going on around them? Well, I think it may well be my favorite topic of conversation right now, which is curiosity. Curiosity, I think, is the spark that creates a romance. It's the tool that allows us to engage and communicate successfully. Curiosity is the thing that really gets our heart pumping and our blood racing. We need to ask questions to people rather than assuming we know the answers or we understand who people are and what they're doing. So my advice to the person asking this question is start with a question. And it occurred to me that questions are probably one of the most strongest tools that we have as IOSH professionals just a couple of weeks ago. And I wrote about it in one of those posts that I mentioned on LinkedIn, The Life of the IOSH President, where I received an email from someone and the email began, "Hello, Andrew, how are you doing?" And then on the next paragraph, it continued on with the business. And I responded to the email saying, "Hello, Rob," and gave an answer to the business question. I didn't respond to the first question, "How am I doing?" Moments later, Rob sent me a second email saying, "Thanks very much for that information, but you missed the most important question. How are you?" And that second asking of "how are you" caused me to stop and think about how I really was. And I realized I was quite under pressure. I was feeling a bit anxious about some of the things that were going on in my life at that moment. So my greatest advice is start with a question. Find out what the experience of these people are beyond the workplace. What are they most concerned about? What do they feel are the biggest risks in their workplace right now? And what ideas do they have to help mitigate those risks and work with us?
Thank you, Andrew, for answering those questions. It's quite delightful having you with us today. Thank you for your time and taking time to answer the questions.
Thank you, Kayode. It's been a pleasure to be here with you. I'm going to go now because I have another meeting in 4 minutes' time. So thank you, everybody, for joining us. I'll post the link with the LinkedIn connection so that you can join those weekly discussions. We've had several thousand people each week sharing and commenting on those. So please do use that as a thread to share your ideas and experiences too. I wish you well with this webinar today as Louise and Kayode take you through this presentation on mental and physical health and well-being that the presidential team has put together for you. You'll be able to download copies of these slides at the end too. I hope that you find the session useful. Thank you again for all your efforts as an IOSH professional, whoever you are and wherever you are right now. As I said before, this is the turning point for our profession. Stand up, be proud, and lead forward. Thank you for doing that. Bye for now.
Thank you, Andrew. Okay, I am going to hopefully share my screen now. So let's see if we can get that up and running. So hopefully everybody can now see my screen. Let's go back. Okay, so welcome to this webinar and thank you to Andrew for that excellent introduction. As Andrew explained, this presentation has really been the sort of has come directly from the presidential team, and it's been our goal to reach as many members as we can. Hopefully by the end of this session, we're going to go through the psychosocial issues and when to reach out to a psychological or social counsellor for assistance. And we're going to go through the stages of prevention, the variables that determine stress, the risks posed by our current situation in respect of COVID-19, the negative cycle of multiple psychosocial issues and breaking the chain of causation. And we will be concluding with an information sheet. And as Andrew explained, the whole presentation is being recorded. And we're very much hoping that members will be able to use the information here to really reach out to your individual networks as well. So I'm going to start with a poll. So it's just a very simple poll. What I'd like, if we could just bring that up, you're going to, and if you could just answer the question, are you feeling anxious? Are you feeling stressed with the current situation? So it's just a yes or a no answer. So if we could just bring up the poll, so just a very simple yes or a no. Okay, so as I said, the presidential team has been presenting this, and it's very typical. So we've got 74% of people at the moment are feeling stressed, and you know, so this is a very real situation that we're in, and we are collecting and collating these stats. So it's something for us all to be thinking about. So in terms of how we're looking at this and what we can do as IOSH professionals, there is some science behind this. So in terms of how we're dealing with this, of course, the primary aim that we have is to keep people healthy at that time. So I'm going to be talking about that during the presentation. And the secondary prevention is when people start to show indications of a problem, is how we mitigate that. So that becomes the secondary piece. And of course, the tertiary piece is when people are actually ill, how do we offer them support at that time? And in thinking about these levels, our primary role is always going to be prevention first, which is very much a message that runs through everything that we do within IOSH. So this model, there's quite a lot of information on here, and you will be able to download the slides. This is taken from a soon to be published IOSH mental health guide, and is an image that's been provided by Chartered Fellow Chris Germain from his publication, Can We Talk About Mental Health? And this message really starts to put in place the kind of roles that we have as IOSH professionals. So it's thinking about how we can maintain a healthy work-life balance, how we can provide a healthy psychological organisation where good work is good for everybody. And the model really starts to put in place how we move through reactive control measures. So controls can be identified by measuring potential ill health stresses. So it could involve using questionnaires, asking people to respond, just as you've done in the polls today. And that starts to give us a picture of what's going on within organisations. But remember, once people are starting to feel the effects of stress, any controls that we create or introduce at that stage are reactive controls. It's because people are already suffering from that mental health illness. So some of the typical reactive controls that we are starting to see are certainly employee assistance programs and access to mental health first aiders. So whilst these are good controls to have in place, they are reactive controls, and our aim is always going to be to provide workplaces that are psychologically safe for all. So within IOSH, I'm sure most people will be very familiar with our 6 pillars, our 6 priorities. And what you will see there is wellbeing and physical mental health is one of those key cornerstones. And I think what's happened around this crisis at the moment is that it's, you know, one of the question that Peter Kelly posed is that this is really thrusting health into a spotlight, and particularly mental health. A psychologist once said to me, managing this is like managing jelly. And so it for some of us, it's a very new area. Also, one of the 6 pillars is rehabilitation or return to work. And we know that as we were going into this crisis, there was an awful lot of uncertainty, but as we go back to work, that anxiety and that stress is increasing too. So we need to be very aware of that. So a prominent researcher in the area of stress at work is Robert Karasak from the University of Massachusetts. And he identified this model which demonstrates how mental stress can be manifested via 3 variables. And this is very much down to an individual's perception. So on these sliders, we can have these sliders in different positions. So demand, and demand could be very high if you're involved in a role where you're putting controls in place, everything suddenly changed, you could be running a business, that demand on your time is great. But equally, if you're somebody who's been furloughed, we know that lots of members have suffered work loss. Your demand equally could be very low. So that's going to affect how you feel. An individual's perception of control, how much you can control your current situation, and an individual's perception of social support. And because many of us have been in isolation or we're working in very different ways from home, we're not having that same interaction that perhaps we were. So although Karasak's model focuses on workplace mental stress, it's applicable to where we are now in the COVID pandemic. Fearing the outcome of the virus translates into a position of high demand for good health and survival. Most people have a perception of not being able to control the outcome. We just don't know how long this is going to last and when we're going to come out of it. Isolation can then translate into a lack of social support. Alongside stress, of course, other factors can also have a negative impact on mental and physical health and well-being, such as poor nutrition, lack of exercise, injuries from accidents, and sleep deprivation. Now, as safety and health practitioners, we're very used to risk assessment and thinking about risk assessment. And when we think about the effects of the crisis, it comes out as high. If any of you have been doing COVID-19 risk assessments, this is a highly infectious virus with poor outcomes. So we're dealing with something that's naturally higher risk. Now, the year 2001 marked the ILO's entry into the area of stress at work, and its flagship programme SOUL, the ILO described a model at which stress could trigger one or more negative outcomes of any or all of the triggers which can trigger in itself stress, leading to this negative spiral. For example, the stress associated with COVID-19 generated, as mentioned before, through high demand, lack of control and lack of social support can put an individual into a frame of mind that precipitates some of these outcomes. In particular, we have all heard of the fact that there's been a rise in domestic violence where, for some, working from home has been a great outcome. I noticed one of the questions saying, there are many positives that have come out of this situation, but for many, they may not have an appropriate place to work from home. They may be in a situation where they feel trapped. And so this domestic violence has definitely been on the increase. If you're concerned, you're going to have inadequate sleep. It can lead to addictive behaviours, inadequate exercise, and certainly financial insecurities. So all of these negative outcomes become connected with each other, which brings us on to our next poll. I'm going to bring that slide up again, and what I'd like you to do is just for a moment think about how you're feeling at the moment. And 3/4 of the people on this call were saying, I'm feeling stressed at the moment. So thinking about those negative outcomes, how many of those do you feel you're it, you know, is something that's affecting you at the moment. Okay, so yeah, so I'd like to be in the 6% that said none, but certainly, you know, a good proportion of you are between 2 and over 4 as well. So, you know, when I was talking earlier on about how we start to risk assess this and identify triggers and how and where we need to support people, this is how, you know, just simply asking some really simple questions, and how do you feel, asking people how you feel, will you know, flag up these kind of things. So yeah, that kind of fits with, and actually I think some of this is increasing, so it certainly fits in with that piece around coming back. Okay, so another sort of image that I think we're used to using as IOSH professionals is this, you know, thinking about these dominoes and how can we really break that, and what is it that we can do to break that chain of causation. The World Health Organization in particular has said, you know, we need to think about the information that we're absorbing. And I wrote on this last week saying, you know, when a new piece of legislation comes in, you know, we're kind of all over that, and we look at it and say, well, how are we going to implement this within our organizations? In the same way, we're getting information as IOSH professionals coming through on an almost constant basis, and it's how you deal with that amount of information. So certainly thinking about the types of information that you're taking in, not watching too much news, and choosing wisely the places that you go to for your information. So Andrew mentioned the IOSH resources. World Health Organization has got some excellent resources, and Public Health England if you're in the UK. So what is the role of the IOSH professional? So we had in a recent webinar, one of our webinars, we've been looking at this and what our roles are as IOSH professionals throughout this, and it's something that the World Health Organization has responded to as well. So our main roles, we feel, are looking at risks, considering those individuals that are particularly vulnerable, providing good communications and engagement of workers, looking at how we can provide psychosocial report, and collaborating with community and public health bodies. So this image has been taken for a soon to be published IOSH Wellbeing Guide written by the IOSH content developer Chris Burrow. We feel that there's 3 key pillars to creating these wellbeing strategies. So occupational safety is something that we all recognise. So if people feel that they're safe at work whilst they're working, their well-being will be improved. Risks of ill health could be to do with occupational disease, it could be to do with physical injuries, disabilities, work-related stress, and mental ill health. And mental ill health is, remember what I said about, is it can be very much a personal perception, and it can be influenced not only by the workplace, but what's going on in someone's personal life. So again, whilst we're in this strange situation that we're all in, thinking about the new normal, what's going on in people's personal lives, particularly if they're carers, can impact on their work. And we want to really want to help our members to really focus on workplace causes. But it could be that there needs to be those support mechanisms in place as well. So if we think about general health promotion, how we can create that is very much looking at a complete and holistic view. And I think right now as IOSH professionals, we're working with colleagues in support functions throughout organisations to look at how organisations really structure themselves to support their people in a different way. So how can we make sure that there's good work-life balances, that structures within organisations are fair and equal? Nutrition and physical activity is considered to be important. Mental health, ill health therapies, self-help, task and financial management, general or further education, and cognitive stimulation and social skills. And all of these pieces really come together in our wellbeing strategy and how we can improve wellbeing to create an organisational culture that cares about its workplace people. So I think throughout this whole crisis, as IOSH professionals, we've been very much working with colleagues around the world. And particularly, you know, IOSH have got a large number of members in Asia. And I remember talking to Darren Brenton, who's the chair of the branch in Singapore. And he talked about, you know, when we support others, it's really important for us to support ourselves. And sometimes that doesn't always come naturally to us because we're out there to support and help other people. But I remember him giving a great analogy of, if you get on an aeroplane and they give you the safety briefing, and they always talk about the oxygen mask, and they say it's important for you to put the oxygen mask on you first. So how we're feeling and our support networks are really important right now. So whilst you are doing all of this work, just think about yourselves. And one of the things that I have noticed, I myself feel like I've had a bit of a dip over the last couple of weeks, because there's just been so much to do. And as people come back to work, we want to help people to come back to work safely. But I think we should all recognise the pressures that we're personally under as well. So it's listening to your own mental and physical health and well-being as well. So really think about yourself too. The whole point of being in an organisation like IOSH is that we create frameworks and connections that can support each other. So, you know, we need to talk about how we're feeling, and really listen to those around you as well. So just like Andrew said, you know, how are you feeling? How are you really feeling? You know, the pubs will be open in the UK on the 4th of July. So we'll have those opportunities to create those connections, and being physically separated is not the same as being socially separated. So please do think about your own well-beings and your own well-being and health as well. So it is important for you to care about others. Just, you know, look for those pointers. If you're in a larger organisation, you probably have an assistance programme. But even if you're in a smaller organisation, or if you're self-employed, you work for yourself, you know, reach out to your trusted colleagues. And also reach out to, you know, there's charities, there's support mechanisms out there, but please don't feel that you're alone, because there's always somebody that you can talk to and who can support. But it is important to talk those issues through, and I think what we can do more than anything as IOSH professionals is remove that stigma, so people feel that they can actually have those conversations. Now, this information sheet that we have created is available for everybody to use, to download, and by all means rebrand it, but it can be, you know, you by all means use it within your organisations or with your family and friends. So further information and links are there. As Andrew said earlier on, IOSH are creating some fantastic collateral at the moment, lots of good information, and we recognise that wellbeing and managing stress within organizations right now is it's going to become a very high priority for all organizations. So there is going to be new information coming through shortly. But that concludes my presentation. So I'm going to stop sharing my screen. And I don't know if there's questions coming through, Kayode.
Hey, thank you, Louise, for that impressive presentation. We've got some couple of questions trickling in. There's one which is meant for Andrew, but I think you will good if you can take that. Would you agree that it is desirable that organizations strive to gain past 3002?
With any of these accreditations, it really depends on where you are in your organization. So I always describe everybody's on a journey and not everybody's in the same place. I think striving for any accreditation is a positive thing to do if it comes from the right place. So if you really are living and breathing this within your organization, any accreditation is going to be a good thing, but it's got to be part of your journey. So if you're in a smaller organization, it's kind of starting from the start and having those conversations to start off with and creating a simple structure, because people might not have talked about this before. So I guess the answer to that question is it depends where you are in your journey, but if you're in the right place, then go for it.
Thank you, Louise. I think any accreditation program will actually have benefit to organizations anyway, so I think I'm in line with you on that. There's a question from Kate Graham. I think it would have been good if you had used the full meaning of EAP. But what's the best way to promote an EAP and overcome any reluctance people have to use it?
So yeah, that's a really good question. Okay, so EAPs, in doing risk assessments and looking at how different organizations are dealing with this at the moment, what I'm personally seeing and finding is that those organizations that think about how they're communicating any of their messages right now are the ones that are kind of getting through this. And when I say communication, I think that we've got to turn the way that we communicate with people completely on its head. So it's about looking for new ways to communicate. It's not just about sending emails out. It's about starting those conversations, and it's about having one-to-one conversations with people and giving people the time that they need. But Kate, you're absolutely right. You can have an EAP, you can have all of those arrangements in place, but people still feel that they, and I think it's to do with the whole stigma piece that's around this, is somehow we've got to make talking about this normal. I remember talking to somebody a while back in an organization where, and it was, they employ sort of 50 engineers, and one of them said, and one of the directors said to me when we started their wellbeing program, is, Louise, I've got more chance of asking these guys if they shave their legs than how they feel. But actually, we started having those conversations and they're becoming more and more comfortable with talking about how they feel. And so I guess the answer to that question is to start simple and just to give people the space to talk, and then they will feel that they can take up your offerings, the kind of support that you're offering.
Thank you, Louise. There are more questions coming in, but I think I might need to. There's one that's requesting for, okay, is there any format to do risk assessment for mental health? I think that's a bit tricky.
Yeah.
Risk assessment for mental health.
Yeah. So with the risk assessments, you've got to start with use it in the same way, and it is tricky. So you know, what are your hazards? So I would say, you know, use a climate tool, talk to your people, find out what some of the key issues are, and break it down into those pieces that we talked about. So, you know, control, organisation, that kind of thing. I'm going to, seeing as Peter's on the line, I will plug the HSE's Talking Toolkit, because that breaks down hazards as well. So if you just go onto the HSE website and Google Talking Toolkit, it kind of breaks it down into hazards. And then you can start to move through and evaluate your different pieces. So I would start with there, and I think once you've got those hazards and you've got that kind of building block, you'll probably find that the risk assessment flows afterwards.
Yeah, thank you, Louise. I think just to add to that, I think there's been some series of guidance that's been published by HSE as well, which can be a useful tool for us during when we want to carry out risk assessment for mental health. I think I have one here, which was published in 2009 on integrated quality, safety, and risk management framework. It's a useful guidance that we might want to look at and see how we apply that during the process of carrying out our risk assessment. So
I've got a question, Kayode. I've got a question.
Okay. Yeah.
So, Kayode, you're in a different region. You know, I've spoken quite a lot about what's going on in the UK. Where you are, when we're talking about mental health, wellness, what are the, you know, differences and challenges that you feel that you face?
I think there's quite some bit of differences, and most of the mental health stressors, look at in Africa, is more related to the fact that a lot of people are losing their jobs. So a lot of stress in people, and of course resulting in mental health issue, financial constraint as well. And of course, because of minimal support from government, I think we don't get as much support from government as we do in developing countries like the UK. So those are some of the key mental health related issues that our members are actually faced every day. So, but in terms of addressing that, take that a bit further, there are a lot of the local network, like the IOSH West Africa network. We are actually using that to educate our members. We've also run this as well, this presentation in our region as well, which was run by David Gold, one of the IOSH VP. So we are using that to also educate and enlighten our members, and also encourage members to connect and speak more to our members, communicate more within ourselves. One thing we do is we try to help a lot of people, but we are not saying we also need to help ourselves, you know, communicate more within ourselves, and also listen more to our members and see how we can offer support to them when the need arises.
Yeah. I'm just picking up on some of these questions as well. So Phil Rawlinson has talked about how do we create positivity in all of these conversations. Now, you know, we've never been in a situation like this. It's, you know, we're living in unprecedented times is the phrase that gets used, but actually there are opportunities. So how do we create positivity? And I think, you know, we can only get through this with really strong teamwork right now. So it's certainly about bringing our teams together and saying, okay, what have we learned? What can we do to move forward? And I think people are the answer. How can we reinvent ourselves? How can we make what we do better? You know, because some people will like working from home, some people don't like working from home. How can we create an organisation that gives people the freedom to get the best that we can, and for that to be good for business? Because we know that good work is good for mental health too. So I guess, you know, the answer to that question is going to be through our people, I think. Yeah,
I think I agree with you, Louise, on that. There's a mini survey that carried out recently by one of our members, and it shows that there's been a lot of relief from members who have the ability to work remotely, who have that flexibility at work, and who were able to give, who had the opportunity of being innovative and allowed to carry out in a more innovative manner. So I think that's one way of also ensuring that mental health issues are addressed at individual level as well.
Mm-hmm. There's just a question here from David, who's self-employed, and you're feeling isolated. David, by all means, message me on LinkedIn. But my advice would be, please connect. You know, you are a member of IOSH. Please connect with your branches or sector groups. We're really trying to keep the branches going at the moment, and a lot of them have gone online now. And we want to be supportive of our members. If you're self-employed, you know, I can relate to that. Running a business right now is tough. But please know that you are not on your own. And yes, there's the mentor scheme that IOSH is running is fantastic, and it means that you can have that one-to-one support with somebody that you can talk to as well. So you are definitely not alone. By all means, connect with me on LinkedIn, but also, you know, have a look on the IOSH website, because there's lots of branch meetings going on, and that's what being a member is all about right now. Is, you know, we do need each other more than we've probably ever done.
Okay, I think there's a question here that I might want to pick up. How far do you think we should go in terms of support and referring individuals to external bodies when a person's personal health is impacting work and it's not work-related challenges they are facing? I think as an employer, some of these non-work-related issues can also impact on individuals' work as well. So we are there to offer support and ensure that some of these issues are addressed as quickly as possible. So I would rather say when there is need for us, if we identify these issues, it's also very important that we do refer for guidance and support from professionals when the need arises. Of course, when these are resolved, it adds benefit to the organization as well. So beyond, we also have a moral responsibility to our employees as well. So even though it's non-work related, they still bring these things to work, and it's very important that employers should be seen as going a bit beyond normal and helping support to individuals who show signs of mental health. Louise, yeah. I don't know.
Yeah, I completely agree. You know, every business is going to be different, and if you work for a larger organization, there's probably a lot more flexibility there than if you work for a smaller organization. But I come back to teams, so you know, it is really important. What's going on in the background with people right now is just as important. And what's going on with people at home is unprecedented too. So good employers need to care about what's going on in both areas. I think there can be a point where you know, as an employer, you've done absolutely everything that you can, and at that point, it's, well, you know, is being there still going to be, is that going to be harmful for the person? But I think, you know, most people I'm talking to at the moment, by giving their people the right type of support, everyone moves together and moves forward, because we're kind of all in it together.
Thank you, Louise. I don't know if you want to pick up another questions from. I guess a question here on mental health management standards. I'm not sure if I'm not sure of any detailed standard. I know some guidance, but I don't know if you have any to say as regards that.
Yeah, I mean, there are standards.
Mental health management standards.
Yeah,
so.
yeah. Yeah, so there are standards that are coming through, and there's standards that's being developed. Peter Kelly, who's on the call, I know he's involved in some of the ISOs. So there are standards that are coming through, and there's a lot of work going on at the moment. I think there's going to be a lot of research that goes on around where we are at the moment that's going to provide us with extra support to go through this. But I would reiterate for anybody, particularly if you're in a smaller company, look at the HSE's Talking Toolkit. The IOSH have also published a good guide. It's a few years old now, but it's the Irish workplace study where they looked at psychological risks in Ireland, and IOSH supported some research, and there's an excellent tool that sits behind there, a questionnaire, so I would point you to that as well.
Thank you, Louise. I think there's a point raised by Kieran about the need to remind our members about the code of conduct if that they feel they are being treated inappropriately by someone within IOSH. And of course, these are some of the stressors. Can also be a stressors when someone is being treated inappropriately. So it's very important. IOSH Code of Conduct is there for us as guidance, and as professionals, we should be working in line with the Code of Conduct. So, and I think any IOSH member should know that already, and it's very important that we do adhere to that. Say anything as regards that as well?
Yeah, and everybody's different, and sometimes if somebody's acting in an inappropriate way, that I would say the question is also why, you know, what's going on in their lives too. You know, Kate Graham said here is that, you know, everybody's, you know, we're all in the same storm, but we're all in different boats, which is what Emma said on one of the recent webinars. Everyone's experience is different, and we don't know what the person next to us is going through. So I guess it's having that curiosity and asking the why, because we don't know, and you know, and just talking and being there can be that support that that person might need. I think we're probably getting to the end of the time now, Kayode.
Yeah, I agree with you, Louise. I think it's very important as organizations, we also educate and enlighten our members on how they recognize the signs of mental health as well. Like you said, you never can tell. Someone might have acted in a way that could be a sign of signs for mental health as well. So we need to ask the right questions as well.
Yeah. Well, I think we're gonna wrap up. Just thank you to everybody who's come on this call. This presentation has always been designed for members who are probably supporting other organisations. So, you know, being part of IOSH means that you are not on your own. So, you know, do reach out to your colleagues, but it would be great to have your feedback on this session. So, Kayode, have you got a last message?
Yeah, I just want to say thank you to everyone for being here today. We'll also want to encourage our members to reach out to others. We take care of others, we also need to take care of ourselves. So within your network, within your group, reach out to your members. You never can tell when that communicating with them you might also be helping out someone as well. Thank you.
Thank you.